Hey, around we go, playing that game. Sell, move, use, be done. They want us to stay. Hey, around we go, playing that game.
Well, anyways. Hey, everybody. Welcome to another episode of Irreplaceable Truths. I'm Dr. G, retired veterinarian of 30 some odd years in the industry. And I am very lucky today. I have Dr. Justin Grecco with me. Whoop, whoop.
Hello. Thanks.
Oh, man. So I met Dr. Grecco when I was in general practice, and he actually is a mobile veterinary surgeon. And I think I wanted him definitely to be on here because we're trying to talk to people who think that clinical medicine is, being in a clinic every day is not going to be their speed. Mm-hmm. So why don't you give us a little bit about yourself, your history, undergrad?
Well, undergrad, I went to U of I. I'm sure you're happy to hear that. Yes.
Yeah, I had to put that in there.
Yep. Everybody's sad about yesterday. But I was there for 2 years, played on the baseball team, had some injuries, and then actually transferred back to the UC Davis once I realized that I wasn't going to be a professional baseball player, sadly. So, but it was great to be out there, transferred to UC Davis once I made up the mind of, vet med path. And it was a great choice because there's a lot of opportunities there for pre-vet students. Obviously, there's a teaching hospital, and, I got very involved. It was my life then. I was there constantly volunteering and putting in the time, which, thankfully I think helped get me into the school, first try and went right to vet school. And then did an internship at UPenn, rotating internship. And then luckily got right into a surgical residency right after that at the Animal Medical Center in New York City, which is one of the oldest programs, fantastic program, kind of like, you need to sink or swim sort of situation.
Which one's older, AMC or Boston?
Oh, Angel. I'm going to say AMC, but I'm biased. But they're close, I think. Yeah. And they're founded very early on by Humane Society in the cities, and turned into big teaching centers.
The monsters they are.
Yeah, exactly.
In a good way. The monsters in a good way.
But when I was there was one other specialty hospital in the city. And it has just exploded since then. They were the only game in town pretty much, which was great for me because I cut thousands of cases. We were so busy. And I mean, I was on call and I would pretty much always get called in. It was rough, but looking back, I was like, what an experience. But now it's just like, I have a couple of friends that are staff there now, and they're like, oh yeah, emergency's not that busy. And so it's going to be a lot easier, but the training is going to be very, very different at this point. So anyway, I thought I was going to be in academics my entire career, to be honest. So I went back to Penn. I was a lecturer for a couple years, and then I actually applied and got the orthopedic faculty position, but then decided to go into private practice. Long story short, ended up back out here, took a corporate job, with a big corporate practice because my stepdad was ill, wanted to help my mom. So I came out here, and then after about 6 months being at the corporate practice, I'm like, this isn't going to work. And I didn't want to move again, and I didn't want to, at that point, start my own practice in terms of a brick and mortar, but I decided, okay, well, maybe mobile surgery is the way to go. And so I basically went all in on that. And that provided a lot of really nice perks for that. I mean, it took a while to get going, and it's kind of scary when you're used to a salary and a guaranteed salary and you have 2 young kids. It's a big leap of faith, and I'm so glad that I made it, but it was pretty scary, to start, because you go from a guaranteed salary to, well, if I don't do anything, I'm not making anything. And so you're completely, helpless in that regard. And so it was a little stressful to start, but it turned out, I'm very grateful how it turned out.
And I think mobile veterinary medicine in general has really gained traction.
Absolutely.
So for people who really love the profession but don't want to deal with the animal client, I mean, obviously your clients are the veterinarians. That's easier to deal with.
Sometimes.
Sometimes.
Not everyone.
Right.
I'm not talking about you, though.
No, I was a good guy. I was good. We used to have fun.
Of course.
Going back, so you didn't know until maybe your junior in undergrad that you want to be a veterinarian?
Yeah, I was thinking, I was thinking something I could help people, or something that can't help themselves. So I was always, I don't know, like police officer helping people that can't help themselves, pediatrician, veterinarian, so I don't know why, but I was
The
always
service sector.
the service, but yeah, I guess in some ways, but I wanted to help, people that couldn't help themselves, or animals, kind of like in the innocent that is getting, having trouble. And I guess I wanted to be a hero in some way.
You're looking for fulfillment.
Yeah. I wanted to help, people, I wanted to help in some way, and I wanted to focus on the people or animals that would have trouble helping themselves. You know what I mean?
Right.
I guess. Yeah.
I absolutely understand. I
Yeah.
think that's why a lot of us get into it.
Yeah. Well, what I always like, oh, well, you must love animals because you became a veterinarian. Like, I think just loving animals is a horrible reason to become a veterinarian, in my opinion. Yeah, I mean, it's got to be there to some degree, but if truly you just love animals, like, there's a lot of other things you should do and you can do without becoming a veterinarian, that you can enjoy being around animals and interacting with animals, and you don't have to see all the horrific things that you're going to see. You don't have to deal with all of the horrible things you have to deal with the clients and financial stuff. And, so I think, having an appreciation for sure is a requisite. But just loving, because I hear that all the time, right? It's like, oh, I love animals, so I want to be a veterinarian. It's like, that's great, but it's got to be more than that, in my opinion, or that's, in my opinion, not going to be enough fuel to sustain your career lifelong if you just really like animals.
Okay, so what else do they need? What would need to be in their toolkit if they wanted to be a veterinarian, if they're thinking about it?
I mean, so I'm a little biased because I've always been in like the specialty side of things. So that's a lot more, problem solving and dealing with some really horrible stuff, like horrible cancers, horrible injuries, et cetera, et cetera. I guess in the day practices, you're dealing with less of that, and it's more kind of wellness. So I guess there is more of that kind of, just hanging out with cute puppies that are healthy and stuff like that, which is fantastic. But I didn't really ever have that experience. So I'm kind of biased in terms of what I think you need. So this may not be accurate for a general practice wellness clinic. So again, with that caveat. But for what I was doing, I think that, really having a strong, science background, problem solving, critical thinking, critical problem solving is imperative to be, a good clinician, obviously. And then, also you've got to be pretty thick-skinned in lots of different ways, because you have to be thick-skinned with clients, because again, with the emergency side of things, they're coming in, they're very emotional. They're getting, told your dog or cat or whatever might die, and you have to pay this huge amount of money or they're going to die. And that's a horrible situation to put people in. So especially when they can't afford it. And so you're dealing with a high level of emotion. And so, everyone's like, the other classic thing that drives me nuts is like, oh, I don't really like dealing with people, so I want to go into veterinary medicine. That is the worst thing you could do.
Yep.
Because guess what? No animal just randomly walks in and says, hey, I've got a blown ACL. There's always a person attached.
Walks in on their own, right?
Yeah.
He takes an Uber.
Guess what? They all come in with a person, and the person is the one that you have to deal with. And so,
it's like being a pediatrician in that point.
Absolutely. You have to deal with the parents. So you have to deal with people constantly. And someone like yourself, really good people person, you're going to be successful. Whereas somebody, all of the straight A students, in school, the classic would be, so the straight A student sitting in the front row, look in the back row, and I'm not saying you're the C student, but in the back row, all the C students.
I was the middle of the bell curve. I admit that.
Well, there you go. So you prove the point. Is like you look in the back, look at all the C students in the back having fun. All those A students, you're going to be working for the C students in the back. And the C students in the back are the ones that are going to own the practices and have the followings and do really, really well. Whereas the A students are going to be probably very thorough with their workups and have a lot of knowledge, but that skill of working with and being able to talk to people and connect with people, like if you don't have that, it's really difficult to thrive in private practice. And those people that really lack those skills, I think they'd probably be better suited to something that has less of that, like clinical pathology, radiology, something, or mobile. I think a lot of veterinarians do. I think a lot of the reason why veterinarians go into mobile stuff is because they are that type of person. You know, veterinary medicine doesn't draw like big, exuberant, big personalities typically.
Right.
Usually we're introverts, we're science-based, we're kind of nerdy, and it's rare to have someone like you that's an extrovert, that, you know, is a people person. Now those people go to business school, or they go to into sales, they go to other stuff like that where you can really capitalize on those skill sets, whereas veterinary medicine doesn't draw those type of people typically.
You think veterinarians, but I think veterinarians need,
Yes.
they need to be a
That's my
marketer.
point.
They need to be a salesman. They
Yes.
need to be able to look someone in the eye and have a crucial conversation while containing their emotions.
Absolutely.
And that's the problem. So my dissertation, I'm looking at, I think, and I'll make the argument, I think most of the time we keep attracting the same students and wondering why we're having the problem we're having.
What's the definition of insanity?
Exactly.
Right?
And that's so funny because I'm using, my whole dissertation's based off of attraction, selection, attrition theory, which is you make this homogeneous population because like attracts like. And I agree with you 100%. It's like there's some amazing papers that have been written, but they don't really address the real issue, which is what we're doing is insane.
Yeah. Doing the same thing over and over again, expecting different results. Yeah,
Exactly.
Yeah. I think physicians deal with it. You know, you see that. You go to a physician and you try to have a conversation. Not all of them, obviously. There are wonderful physicians out there, of course. But, you know, my experience is you go, and a lot of them, you can't even have a regular conversation with them. You know, it's like they you know, it's different because their minds are different. They're just thinking about other things rather than being able to, you know, conversate properly, or they don't have those people skills because that's not what the professions draw, like you're saying.
So going into vet school, but hold on, before I do that, I got to give someone some props. So saying like attracts like, your household's just like mine.
Yeah.
You're married to a very successful, intelligent veterinarian as well.
True. Yes.
Yes,
Absolutely.
exact-
That is a strong yes.
That's a strong yes. So like does attract like. Is that insanity?
Yeah.
Because you can never, don't get me wrong, I love my family, my wife, everything.
Amy's wonderful. She's
Yes.
so great.
But sometimes I just want to be able to shut off veterinary medicine when I get home.
Well, so we met in a residency in New York City, and it became, within about 6 months of dating her, I had to make a rule because she, and I don't know if your wife's the same way, but the first thing she wanted to talk about when we got home was all the cases that
The rumination is real.
Yeah, and I get it, but I'm like, I'm the wrong person for that because I just got done with rounds. I'm on call. I don't want to talk about veterinary medicine for the 2 free hours I have and then have to go back in and cut some emergency case. Like, can we talk about anything else?
I want to turn on the Yankees game.
Yeah.
I want to watch the Giants lose again.
Yeah, anything. But her mind was she needed to kind of do like a review of the day or something like that.
To make sure that she didn't mess up.
Yeah, maybe.
Yeah,
part of it.
I get that. And that's a big issue in a lot of veterinarians is that they do not know how to let go, right? They take it home with them.
And so I was going to say, another annoyance that I hear all the time is we treat your pets like family. I get it. It sounds nice and all that stuff, but think about what that means to the veterinarian. So if you're treating every patient like it was your dog, think about the emotional toll, A, that's going to put on you, and B, you're not going to, I don't want my family member making major medical decisions like in the heat of the moment because it's going to be way more difficult to not be objective.
Right.
Like you should have an objective detachment from the situation because emotions, sometimes they'll serve you, but a lot of times they will not serve you well. And so and I get it, it's a marketing thing, like we treat your pets like family, but if you really think about it, that's a horrible thing to do in that regard, in my opinion.
Right, because there is a better marketing ploy that I've seen used, which is they give holistic vaccines.
Okay, what's that?
I have no idea, but they're holistic.
Saline?
I have no idea, but they're holistic. Don't worry.
Okay.
I think they're taking that whole thimerosal-free rabies vaccine to a whole new level.
Yeah, well, I mean, I think most intelligent people have a healthy skepticism of just hardcore, just slamming medicines into, it's like, well, selling medicine and surgery, and that's all you have to offer. People are looking for alternatives.
Yes.
And I get that for sure.
Right. I think alternatives are huge.
Yeah.
So going through vet school, you were like, I'm going to be a surgeon.
Yeah.
You
absolutely.
you never deviated off that path.
No.
Was
I actually undergrad. I was a volunteer for what was it called, the Small Animal Surgery Club or something.
yeah.
Basically went in and like cleaned instruments and stuff like that. And yeah, I was doing that as a junior in undergrad. And yeah, I don't know. It's always just been the thing I wanted to do. I've never really thought about anything else. I could never do GP. I just never was interested in that.
See, I could never specialize because
I get it.
I
Yeah.
didn't want to. If I was going to specialize in anything, look, when I was going through school, it was going to be emergency critical care.
Yeah, I see
because
that.
I love that adrenaline. Like, let's go. I don't want to know what's coming through the door. Just don't.
I totally
I
see
don't
that.
want to know my 3:30 is an ear infection, and then my 3:45 is a skin problem, and then my 4 o'clock's another ear infection, and then my 4:50 is another ear infection.
Yeah.
I didn't want to know what was coming through.
Yeah.
But looking back, I think if I would go back and do it again, I would probably go to dermatology.
Dermatology. Yeah.
No emergency, you never cure anything, right?
They keep coming back.
It's a revolving door, right? If you have the cure for allergies, then you should be a veterinarian. You should be selling your cure and then living in Bora Bora on a yacht. That's what I think.
That's right, totally. Yeah. Well, yeah, people always have the skin questions. They come in for an ACL tear and I do the surgery, and they're like, "Well, hey, my dog. While I'm here, you're a vet, right? Like, what about this itchy skin?" And I'm like, I went into surgery for a reason, because I don't want to deal with that skin stuff. It's too complicated. I just want to fix the knees.
But you can't fix the knee unless the skin's in good shape.
Well, it's true. It will delay it a little bit. For sure.
It does delay. Wow. So I hear a lot about, veterinary school being very turbulent, a rough ride. Was it for you?
No.
How did you get through vet school so it wasn't all over the place? Because you have to do very well in veterinary school in order to get that internship.
I mean, maybe the top tier of internships are very
Right.
competitive. Absolutely.
Very competitive.
Yeah, absolutely. Yeah, I don't know. I think I just, when I made up my mind to go to vet school, I just, instead of playing baseball for 4 hours every day, I was studying, not probably all that time, but I switched practicing baseball to studying. And that habit just kind of kept going through vet school. So that I would say is like, develop your habits early, like it's middle school, high school. And once you develop those work, ethics, work ethic and habits, then you just keep those going instead of rewarding merit in terms of you get straight A's in middle school. It's like, well, if you're not putting in 100%, you're not going to be able to maybe do that in high school, and you're going to get floored. And that goes to undergrad.
Straight A's in middle school? Wow. Wow. That's crazy. You're starting your kids that young.
Well, my point is, I don't reward A's. I reward effort.
Right.
So if you get an A and you didn't really care and just kind of whatever, it's like, okay, at some point, and I don't know what point that will be. It's different for everyone and depends on how intelligent you are, I guess. At some point in high school, undergrad, when you're getting your PhD, whatever, at some point, you're not going to just get the easy A. You're going to have to put the effort in. And my point is like developing that habit as early as possible was key. And that was key for me, and that allowed me to get pretty good grades in vet school.
So school came easy to you?
I mean, it depends. Some things I guess did, and other things didn't. Some things were pretty intuitive for me, like anatomy. I always really like that.
Right.
Other things not so much. So just kind of learned to put more time into the stuff that I struggled with.
So you think you had some smooth sailing through school? It wasn't really much of a emotional and burnout roller coaster ride for you?
Not at all. Like school for me was totally the first time I hit rocky patches was my residency. Because
so even landing into your internship, that was a soft landing.
Well, I went to Penn, and I will always love that place. And there were so many amazing people there. When I hit it at an amazing time. It was probably my best year, my favorite year. Great internship class. Anyway, most internships are not like Penn's internship. Sometimes they're, slave labor basically. And if I was in that kind of internship, I think I would have hit the wall sooner. But then my residency hit, and that's when I never worked like that before in my life. Like the difference was you never were off. I was never off. I was on call constantly, working until 1, 2 in the morning.
And you did that for
routinely.
3 years?
For 3 years. So surgery To become board certified in surgery, you need a rotating internship, which is 1 year after veterinary school, and then the 3-year surgical residency. So yeah.
Is it still the same now, or do you have to do a surgical internship as well after your
No,
rotating
you don't have to
internship?
do a surgical internship, although it's very common that you need to do one to get a residency. Yeah.
So it is almost required now.
Yeah, it's not technically required, but it's, needed. So yeah, think
Unbelievable.
about finishing the 4 years of vet school. Like, oh, I'm done. Like, just kidding. 4 more years. And by the way, the 3-year residency is going to be way more difficult than anything you had to do in vet school, at least for me. Way less studying, but way more work.
So now you're on this turbulent ride of residency, and then you hit your first job post-residency, which, well, you were lecturing at Penn.
Yeah, so my
that
first-
was
that was
easy. That was
easy
fun.
street. That was
fun.
great. That was great.
Working with students is so rewarding.
It can be.
It is so rewarding.
Although I just did a locum at University of Illinois, and the great school, great people, great students. But I will tell you, the environment is very different than when I was
Well,
full.
Dean Valley back in the day when I was there, he was incredible.
Yeah.
Like, ultimately, I would love to be a dean of a veterinary school. I would love to be in there with the students. Like, because you need the problem, like Dean Valley, when I was there, he would invite classes, the entire class, over to his house for dinner.
Ah, that's cool.
He would sit in histology class. He would come into surgery. He would
Yep.
sit down and have lunch with us in
Yep.
the little
That's amazing.
cafeteria.
Yeah.
You know, so those were things that were just, I think, priceless.
Yep.
Right?
I had a similar experience at Penn. We would go every Thursday. I forget what we call it, some sort of, Thursday party thing. We would go to a local little...
Thirsty Thursday?
Yeah, sure, that works. Absolutely. And it would be an amazing mix of first-year students all the way up to, tenured faculty. We'd all, in varying numbers of everybody, and go to this little dive bar. It's called Kavanaugh's. And I wish Jeff was on maybe next time. We have some great Kavanaugh stories. And yeah, you'd be like, oh yeah, he's the head of anesthesiology. He's sitting right here eating a bowl of soup, and and there's first years drinking beer over there, and it was amazing. And it's not like that anymore. It doesn't seem like.
No, when I was in vet school, I actually would play golf with the head of pathology and the head of anesthesiology, Dr. Tranquilli.
Okay.
And I can't stress enough also to the students or people who think are going to vet school.
Yeah.
Create those relationships if you can with those professors.
Absolutely. Yeah.
I agree with you. A lot of professors don't care to have relationships.
Yeah.
They want to do their research. And it's usually the ones who do are the ones that usually end up not staying in academia because they don't do enough research, or they're not bringing enough money for the school. But those are the ones that really make an impactful, piece on the rest of your career.
Yeah, absolutely. Yeah, I mean, the hardcore researchers, some of them are doing, 10% on the clinics, and they teach one class a year.
And they try to fail people.
They just don't have this. Whereas more the clinical type people, like me, I would be there wanting to get my hands dirty and not just be in a lab somewhere. So, obviously the hardcore benchtop research is extremely important, but it's just a different animal.
It is a different animal.
No pun intended.
Kids, the students going through school right now, do you think they all need to do an internship?
So it's an easy recommendation because it's not like, dang, I really wish I didn't do that internship, because you're going to learn something, and typically you're going to learn more from a rotating internship than going right to a job, as a broad statement. That's not always the case. So some GPs, and there's less and less now, but some general practices, they do provide mentorship, and they do provide older veterinarians really helping out the younger ones and teaching them. But you correct me if I'm wrong, in my experience, most of them are not like that, and less now, especially the corporates. It's not just, you're a walking license, right? So you're hired, and okay, start seeing cases. You're
a lot of
booked.
money thrown in their face.
Yeah. Oh, yeah. Signing bonuses and moving and all that stuff now. Yeah. But then you're like, all right, start producing for us. And
by the way, you're the only doctor there on Monday, Tuesday, Wednesdays, and Thursdays.
exactly. Oh yeah, the old guy is going to be here Thursdays from noon to 2. Yeah.
Yeah.
Yeah, and that's your mentorship. Exactly. But they're not all like that. Typically, the corporates are more like that than the privates. But there's less and less of those bigger privates because they all got gobbled up. And
the pendulum's starting to swing again the other way, because these corporates, I think they're learning. Well, I think they've learned the hard way that veterinary medicine is not run off a spreadsheet.
Right. Yeah. It's people like you. Put blood, sweat, and tears in, your heart and soul into the practice, and the clients pick up on that, obviously. Yeah, absolutely.
Wow, man. I wish I could go back. I wish I could go back 4 years.
4 years. Okay.
And when I was thinking about it, and just don't get me wrong, there's good things and there's bad things that happened with me selling to a corporate. Good thing was it allowed me to get my MBA, allowed me to go get my doctorate, allowed me to start this.
Do this, yeah.
Right?
Very cool.
It made me realize also that, after 34 years total working in veterinary clinics, I was done.
Yeah.
Right? That's a
long
time.
haul, yeah.
That's a long haul.
Did a good job.
But it also makes me sad because I miss that mentorship.
Yeah.
I miss mentoring those new students.
Mm-hmm.
I miss the great clients, right?
Yes.
Which most people have to understand. That's 96% of your clientele. It's
Right.
the 2 to 4% of your clientele that make you hate
Absolutely.
your job.
Yep.
And that's what you think about all the time.
Yep, absolutely.
You don't think about the wonderful old lady that comes in with her little white fluffy dog and brings a coffee cake every time she comes in.
Yep.
Or stuff like that.
So that's why I went, just over 2 years ago, I went from mobile back to a brick and mortar. And because I missed that, and I was right to miss it, because once I started cranking at the spot, my practice again, not doing the mobile, I was thriving. I loved it. It was so, maybe I'm egotistical, but I really love that feedback from the clients. And you're right, 96+% of them are amazing, and they just make you feel so good because they're so grateful and wonderful, and they say wonderful things about you. And being a mobile whatever surgeon, or there's mobile everything now, it seems like, that's gone. I mean, the veterinarians are wonderful. I got to meet someone like you, a lot of people that now are friends of mine. That's fantastic. So that's the pro. But the con is you get zero real client feedback. You're completely detached from that level of things. You're kind of like a technician. You come in, you do your technical work, and then you leave. It's like you come in, you fix the TV, and you leave.
Do you know who gets the cred?
Well,
This guy for bringing you in, for saving them money, for getting an excellent job done.
Of course.
Yeah, I get the
it.
credit, and I can't thank you enough for that.
Of course.
Because you made my job so much easier, and you made my ability to market myself or my associates to market themselves so much easier.
Well, honestly, two of the big reasons, aside from what I already mentioned going into mobile, was one, I saw GPs getting pinched on all sides. So it's, it's like, you either if you're going to do surgery, you got to go to a surgery center. You're not doing at the GP level anymore. And then, the meds are all being, pet beds or whatever they're called, online and all that stuff. And it's like, and then the clients, it's like, they can't afford the $10,000 going to some corporate specialty practice. So they're completely out of the
10,
next.
That's low.
Or whatever. 4 years ago, maybe.
Yeah.
But then, but they love their dog, and their dog is suffering from an ACL or whatever. And so I wanted to be able to provide more of that specialty level care to a greater number of people. Now, maybe I shouldn't say this, but sadly, a lot of the GPs now are charging almost as much or more. Like my new spot now, they are charging as much or more than what I'm charging at a overnight specialty hospital, because they see, well, people will pay it. And so that kind of got rid of one of the main reasons why I was doing the mobile surgery, sadly. Not all of them.
They're taking advantage of the human-animal bond.
Yeah, of course. Yeah, well, I mean, some people would say that's what we all are doing. Instead of helping, we're taking advantage of, it's however you want to spin it. And certainly, I don't believe we're just trying to manipulate some bond because it's a weakness in people. It's like, because we want to help and we care. Yeah. But there are people that have that mentality, which is just horrendous, and they shouldn't be in the profession.
And they are.
And they are.
And they are.
I mean, and we all know these people. We've met them. Within 10 minutes, you know what they're... And I'm like, why didn't you go into, like, be a stockbroker? Or, like, go into business or something?
Yeah,
like,
financial banking.
Yeah, where that's normal to be, just find a weakness and predate it and make money. Like, but in this profession, I take it personally. I'm like, why are you in my profession? You don't belong in my profession. You know what I mean? That's how I feel sometimes with these people.
Right.
And
that's how I feel about corporates.
Yeah, right. That's basically like that individual times 1,000, right? On a corporate scale.
Right.
It's that personality in a corporate scale.
It's unbelievable.
Yeah, it's really changing, obviously, our profession, but I mean, in some ways, destroying it so it's unrecognizable from even 10 years ago, 15 years ago? I mean,
Well, yeah. I mean,
It-
I always tell everyone like the best years of the profession, in my opinion, were like 2000 or the early to late 2000s. Then, of course, we got hit with the
Great
recession.
Recession, yeah.
That still was great because whatever you could do, I mean, like, you know, people would go paint my house. People would, you know, we went to the barter system, which was no problem.
Yeah.
And then we took off again, and then we get nailed with the pandemic. And the pandemic put a problem that this profession was having. I think it just put gasoline on the fire. So instead of it hitting like at 2028, 2029, 2022.
Just accelerated everything.
Right. The Great Resignation began.
So you're talking the major problem is workforce.
Yes.
Yeah.
The workforce. Yeah. And and it makes me sad because all these young veterinarians, they're putting so much time, effort, sweat, tears, blood, bite wounds, everything.
Oh yeah.
Into it.
It's their identity.
And and then all of a sudden they're like, I'm out.
Yeah.
I'm done.
It's sad. And it's a little, a lot of time, little girl that's wanted to be a veterinarian since they're 5. And it's stuck with them until they're 25. But then reality hits, and now all of a sudden they don't want to do it.
Oh shit, I got to be a doctor.
or something different, and
exactly.
that's sad to see for sure. It is.
People listening, could you walk us through the day now of a mobile veterinarian? If for those who are thinking about, hey, clinic is just not doing it for me.
Well, I'm not doing the mobile much anymore, but I certainly have a fair bit of experience doing it, and it's the nice thing is you can set your day up however you want, and the more you hustle, the more money you make, and that's kind of
and
a cool
it's your
thing.
money,
and
it's like your overhead. You have overhead, but it's minimal
compared to a brick and mortar facility. I've learned the overhead is beautiful. Exactly. It's wonderful.
And most of that overhead is 100% tax write-off. So
yeah,
it works in your favor.
Absolutely. So that's a beautiful thing about mobile is the overhead is so low. And so I'm going to put a little disclaimer out there. So there are like corporations now hiring people to be mobile, whatever. And I won't name names, but don't do that. You don't need to do that. You don't need to get paid. And that, I think, is feeding on people's fear, like I just mentioned earlier, the fear of not having a paycheck coming in.
Right.
It's like, I can't just quit my job and start something that's going to have potentially no income coming in. And I get that fear, and I totally get it. But you definitely don't need to do it. It's not that difficult to set up a mobile practice. Yes, there's some risk. There's some overhead, depending on what you do. If you're not a surgeon, the overhead's way less. If you're a surgeon, like the overhead's through the roof because you have to get out, have to buy all your own equipment and stuff. But even that compared to brick and mortar is nothing.
The one thing banks will do, and I had a financial person on the show. The one thing banks will always do is loan money to veterinarians because veterinarians
they always pay you back.
Yeah, they'll always have a job.
Oh, okay, yeah. I heard that. Yeah, veterinarians always. Most of them feel they will never just walk away. They feel obligated, moralistically to pay back. Whereas a lot of people don't have that. And I'm certainly that way. I'm like, if I owe money, I'm like, well, how can I'm going to pay it back. I've got to, right? But some people, I guess, don't have
different
that mentality.
values.
Yeah, for sure.
Integrity is a huge value that you must have.
Yeah, which is a great segue to what I wanted to talk to you about or mention is what's also sad for me is to see the dropping of kind of societal respect for veterinarians and veterinary medicine. And I don't know if you agree or have seen this, but, even 10, 15 years ago, it was, veterinarians, nurses, those type of people way up top, like, wow, we really respect you guys. You're compassionate.
Right.
You want to help. You're not just about making money. And that's been chipping away big time in the last 10, 15 years, in my opinion. I don't know what the polls say. Maybe we're still up there. I hope we are. But we are.
We're still second behind nurses.
Okay.
I think nurses were sitting at about 84%. I think we've dropped to 69.
Okay, so it's dropped, but we're still number 2?
2.
All right, well, that makes me feel a little better.
What are they going to compare us to? A lawyer? Right?
I guess
financial banker?
Low. I guess the bar's low.
Yeah,
sure,
I mean, there's very few. I mean, obviously, that's why a lot of people want to compare us to medical doctors. And I go, no, you can't.
Yeah.
You need to compare us to nurses. Because we're always emotionally invested in every one of our patients. A doctor's in and out 10 minutes.
Yeah.
They don't even know your name.
Yeah.
It's kind of like how when we go to lens crafters for glasses, do we really know that optometrist's name? No. We're just like, I want the cheap contacts.
Yeah. Yeah.
Hook me up.
I think maybe like the family physician might have a little more of a relationship with patients, but yeah, I think it's definitely a different setup there.
Even then, it's like, well, I mean, you might be right. I mean, because I actually am able to text my physician, right? And actually, my pediatrician has been very actively involved in our family for 24 years.
Oh, that's cool.
Yeah. So yeah,
it can happen. But
it can happen, but if you're in a hospital,
forget that. Yeah.
It's the nurses.
Too big. Yeah,
it's the nurses, right?
Well, and that is, you've been in general practice, which you do have a lot more. But the big, I'm sure the big 24/7, especially emergency, veterinary practice is a little bit more like the big human hospital, where it's a lot less, personal, and the relationships aren't there because you're there for a specific problem and then you go. Whereas a GP, you're there for the life. You're the little lab puppy that needs the vaccinations all the way through, until they're older. So that's one of the pros. Like if you're a people person, I think general practice is a wonderful choice because you're going to develop those relationships. I had an old vet tell me, he's like, I love veterinary medicine, love animals, but what I really love are all the relationships I've developed with the clients.
I miss those.
Yeah.
I actually, it still brings tears to my eyes thinking about, I said this on one of the last podcasts too, was like, knowing my last days there, I was looking at those animals, looking at those clients, and I'm like, I don't freaking trust any other veterinarian to take care of this animal.
Yeah.
But it had gotten to the point where I had to make the choice between my own mental well-being.
Yeah, of course.
And
Well, you paid your dues. 34 years is pretty good.
Yeah, but what's so sad is the 34 years without fulfillment, though. When you get home, you're like, oh my gosh, no. I wish I could have done 34 years for free. You know what I mean? Not get paid for what I did. I felt bad sometimes because I love my profession so much. I was surprised it actually was a paying job.
Yeah, that's amazing.
Did you ever feel that way? Like,
yeah, I mean, I see what you're saying, but I also think it's important to value what we do, and that value a lot of time is going to have a financial value to it. You know what I'm saying?
I almost felt guilty because I was like, this is a job. Like I would be there from like 8 to 6.
Yeah.
Next thing I know, it's 4:00. I hadn't eaten lunch. I don't know where, I don't even know if I go into the bathroom.
Yeah.
And then it's just like, because you just get so involved and it's like solving puzzles and dealing with people and, especially the ownership piece is actually a lot of fun because you can, dibble and dabble. Like, hey, let's play with this. Let's take this ad out over here, right?
Yeah.
Like back in the day, it was phone books, and I think phone books was the biggest. Phone books were the biggest crook there was out there. Talking about someone taking advantage of a situation, or if you don't mark it in the phone book.
Well, now it's Google.
Yeah, it's Google. So, getting back to what you're saying, worried about not getting a paycheck. I bet if you just took out a $5,000 ad in Google and said, hey, I'm opening up a new mobile practice. This is me. Maybe create a video. Find a studio like Pacific Lens. Create a video introducing yourself, saying, I'm doing mobile. This is my location. I think you'd be amazed the amount of people that'll call you.
Yeah, mobile's a little trickier because you're not going direct to public. So the problem, like you said,
but just a mobile veterinarian in general, mobile surgeon.
Sorry, yeah. So I'm obviously wrapped
but
up
mobile
in my own
surgeon,
thing.
No, but the thing is, mobile surgeons, in my opinion, even easier. The second I got an email from you that says, "Hey, I'm doing mobile surgery. I'm a boarded surgeon," I was like, "Call him."
Sure. Yeah, but it's if you're a GP vet and you're going direct to public, I think that would happen very quickly. But if you're a mobile specialist, your clients are the veterinarians, the GPs in the area, which is what you said.
Honestly, how long did it take you to build your practice?
I think within maybe 6 months or so, I was pretty solid. Yeah,
6 months.
Yeah,
I mean that's not that long in the scheme of things. 6 months from a startup.
Yeah. No, it was. Yeah, I mean, in terms of starting your own business, it is about as easy as it can be, and it was fantastic. I will tell you, it's very unforgiving, and you need to be good. And the problem is, a lot of people do mobile, and they're not qualified, or they're it's very unforgiving, because you go out and a veterinarian sees something fall apart or not go well. Very quickly, it's like, they're no good. So you have to make sure you're doing a good job too, obviously.
Correct.
Of course. It
Well,
goes without
well,
saying.
hopefully do no harm, right?
Do no harm for sure.
Right.
Yeah.
And that's something that I think a lot of veterinarians need to go read that again.
Yep. Well, again, and I see that all the time with, people coming to me for second opinions and stuff, is, surgery is a big ticket item. And if you have a lot of bills to pay, it's easy to really try to push people for those surgeries.
Right.
And if I ever start down that path, I will do something
Tap out.
else. I'll tap out, because I just can't be like that. And so I do the risk benefit thing. It's like benefits have to outweigh the risks. Otherwise, we don't do it.
And you have that discussion with the clients.
Of course. Always.
Communication.
Always. You've got to. And you...
Especially when you're talking about, let's say you have a 11-year-old lab that tore an ACL.
Mm-hmm. Yeah. And I have that conversation all the time. This is one of the nice things about not doing mobile anymore, and actually being able to consult with clients is fantastic, because I can talk to them about this. I mean, this is why I'm recommending what I'm recommending. Not because I just want to make money, but these are the benefits and these are the drawbacks. Ultimately, it's your decision.
Right.
But this is, if you look at this analysis, this tells me I recommend it, because the benefits are here and the negatives are here. It's going to be a net good. We should do it. The negatives, you have to pay for it. And there's, take care of it post-op and all that stuff. But the net good is going to outweigh all that stuff. And if you explain to people, not just say, need surgery and it's going to be $6,000, hurry up and pay me. People are not going to like that. I explain to them why you want to do the surgery, of course.
What was when you did mobile, what was the biggest procedure you did? What was the most biggest number of a procedure?
TPLOs. Yeah, knee surgeries. Yeah, that's a bread and butter, absolutely.
Okay,
yeah.
so what was the biggest procedure you would do?
Like
what was your limit? Like, where did you say, I really don't feel comfortable doing that at a general practice?
Well, there's a bit of a learning curve for me, because, and again, you have conflicting incentives. So when I was just starting out, I said yes to almost everybody and everything, because I wanted to put food on the table. I mean, to some degree. I wasn't irresponsible, but I was a lot more aggressive. I would drive to the middle of nowhere and do one surgery. It would be 4 hours of driving for one surgery to build the practice. I wouldn't do that now. I'm grateful I don't have to do that anymore. But that's what I was doing. And
that's the mindset you have to have
to build a business. Correct. In general, right?
Or even to build your clientele in a general practice, brick and mortar.
It doesn't matter what business it is. That's the kind of mentality that you have to have. And that's the kind of mentality that goes away when the big corporate buys you, right? Usually. What were you talking about? In terms of, what I fell into is, some people do them, but chest cases and upper airway cases, they're just too unpredictable. A lot of GPs, chest tubes, if you have a problem with a chest tube, you get a pneumothorax, you got to be on it quickly, or we're in trouble quick. So 24-hour care, overnight care for that sort of stuff was kind of a prerequisite for me. Upper airways, they can swell, they can obstruct. Again, going home or sitting in a cage, with no one watching them, you can get into real trouble. So that was another one. I kind of hard stopped that one. Anything unstable, of course. So pretty much everything had to be elective. I wouldn't be like, hey, I've got this dog that's bleeding to death. Can you come here tomorrow at 4 to cut it? Right. I'm like, yeah, but you won't need the surgery anymore.
I think the coolest case you came in and did for me was that English bulldog. It had a corkscrew tail that was so tight that tip of the tail had punctured through the skin and created an abscess.
Yeah, those are gross.
On the hamstring and the quad area.
So gross. Yeah.
Yeah.
To be quite honest, I hate those surgeries.
I know. Well, that's why I called you, because I don't want to do that one.
Yeah. Having said that, though, they can be very rewarding because, and again, with mobile, I don't see the reward. You did, hopefully.
Oh, I did. We were working with a bulldog rescue.
Yeah.
And that dog, I forget, her name was Star, but her nickname was Smelly Star because it smelled awful, gross. Yeah. Right? And she's living the life of Riley right now.
Fantastic. I've had them where they biting my kids. You can't touch them. They stink, And then you take away all that pain because it's horribly inflammatory, horrible infection.
Right.
It's got to be so painful. And you take away that pain and they're a new dog. And I've heard, they're like a puppy again. They're not aggressive anymore. And that gets me out of bed. That's fantastic. I love hearing that sort of stuff, which I don't really hear doing mobile,
Right.
But
then again, you also don't hear you have to deal with the clients.
Absolutely.
You got to weigh both.
Yep.
Right.
Yep. I don't hear my dog vomited and you just did a TPLO last week. I'm like, well, it's probably not from the TPLO. You should see. But I've learned if you do surgery for anything, any problems after that surgery, and it could be months after that surgery, people just like to blame that surgery for anything. I got called like, hey, one of your cases isn't doing well and, needs overnight care and vomiting, blah, blah, blah. And I'm like, oh, geez, what surgery case? Oh, it was a TPLO you did about 6 months ago. And I'm like, okay, probably not, maybe, but probably not anything to do with the TPLO that,
Right.
I did 6 months ago. But
Right.
again, it's like, oh, you did surgery, that's yours.
Well, I had one client that hated me so much.
Hated you?
Yeah.
How could they hate you?
I don't make everyone.
No, you can't please everyone. That's
right,
for sure.
exactly. So I did get her to go in and see an internist, and she started seeing an internist. About a year and a half later, the internist diagnosed an anal sac tumor, and the lady tried to blame me. And the internist was like, you know what, Mrs. X, I've been seeing you for a year and a half. He hasn't seen you at all. Why is it his problem? Why aren't you blaming me?
Mm-hmm. Yeah.
That's
strange.
And because you've been to a lot of clinics, right?
Mm-hmm.
A lot of them are great. A lot of them you run, right?
Mm-hmm.
You start your car, you're like, you don't even say bye. You're just like, I'm out of here.
Yeah.
Is there still a lot of that backstabbing, or do you think veterinary medicine is still a close-knit community that we back up each other?
Yeah, that's a good question. I think for the most part, people are pretty professional. I just had an unfortunate situation where I did have a little bit of that happen to me where, instead of, being professional, it was more kind of a blame game sort of thing. And where you can get into trouble is, by being professional, you're hiding things. I don't think you should ever hide things. If someone made a mistake, you shouldn't say because he's another veterinarian or she's another veterinarian. It's like, well, no, they didn't make a mistake because you're trying to protect that person. Like, I don't think that is good for anybody.
No.
But at the same time, a lot of times it's kind of in the gray area where, they didn't do anything wrong. It just didn't go well. And a lot of people will jump on and want to be the hero, right? It's like, oh, well, they didn't know what they're doing. I do. And I come in, on your white horse and fix everything. And I think it's more of a selfish motivation rather than trying to hurt somebody else. It's trying to build yourself up is kind of what I've seen people do. But I think for the most part, people are still pretty close-knit in the profession, but way less, in my opinion.
One lesson I learned early on is I tried to be that, savior.
Yeah.
And it did nothing but bring me a bunch of heartache and stuff.
Well, as we talked about, is like why we even got into this in the first place, right? So how could we turn that off?
Right, exactly. But the one thing I've learned is that if you think something was not right and they're coming to you as a general practitioner for a second opinion, send them to the specialist.
Oh yeah.
Just don't get involved. Yeah. Don't say anything. Yeah. Just be like, this is a little over my head. Play coy if you need to, but get them to someone who really would understand that there's something that went on, because when the specialist comes down on that veterinarian, it has a lot more clout. Like if a general practitioner, in my opinion, goes after and says something about another general practitioner, it's more business.
Oh yeah.
You're
just trying to take my client type thing, right?
You're just trying to destroy my business.
Yeah.
No, dude.
Yeah.
I'm not.
Yeah.
Sorry. I luckily I'm busy enough. I don't need to.
Yeah.
But yes, you did screw up.
Yeah. Yeah.
But I'm not going to say that to the client. I'm going to let a specialist say that to the client.
Yeah. From a specialist's point of view, because I get that all the time, it's amazing how much clients will fight to the death for their GP, like someone like you. Even if we all make mistakes, let's say you make a mistake, they come in to see me. If I started saying, yeah, Dr. G really screwed up, he did this or did that, they would be like, how dare you say that about Dr. G? He did not. And, you know,
Do you know how many C-sections he did at 3 a.m. for me?
well, you have this 20-year relationship with someone or whatever, and then something goes wrong, and then you have some a-hole specialist like me, all pompous, acting like they know it all and saying that you suck and I know everything. Like, that's not the way to do it.
There's very, very rarely do I meet a-hole specialists out, pompous specialists here in Orange County.
You
Orange County.
You should go to ACVS.
Oh, yeah. Well, you know, I went to ACVIM one year, and I sat in the neurology because Dr. Barry, Dr. Wayne Barry, who's world-renowned neurologist, he's like, hey, come sit with me. And I literally watched them destroy this specialist from the University of Florida who was lecturing on cauda syndrome. Destroy him on stage. I looked at him, and he's just laughing. I'm like, this is what you guys do in your meeting?
Well, at least,
I'm going back to dermatology.
Yeah, I've seen them eviscerate like residents and interns, which is just like, all right, take it easy, guys. Come on, you know. And then the faculty that did the paper or whatever with the resident, a lot of times they won't even get up and defend the poor kid. But if it's specialists, that's kind of the fun part of those meetings is butting heads and seeing what comes out of it.
So do you still go to ACVS every year?
Yeah. Try to. That's, you know, CE, got to get it somehow, right?
Right. Is it still in Chicago every year?
No, it changes every year.
It's changing.
Yeah,
it was in Chicago.
Chicago was a common one.
Yeah.
It used to be like San Diego, Seattle for West, Chicago, Midwest, and then it would be what was the East Coast one usually? I know they did New York,
DC.
Oh yeah. DC was very common.
Yeah.
But now they're kind of all over the place, and I think they're looking for, you know, better deals for venues and stuff.
And I think for everyone listening, I think the specialty meetings, everyone's like, oh, I don't need to go there, be over it. It's not. You learn about cutting edge stuff that you can bring into your own practice, put in your toolkit, and start doing well before everyone else around you. And that could be another thing of your secret sauce, right? I started using pimobendin in 2006 because I had clients who had relatives in Europe that could get pimobendin for heart disease. And I had cardiologists calling me saying, oh, how are the cases going? How are they doing? You know?
No, that's cool.
Yeah, it was really cool. I think surgery is not for the faint of heart, because especially orthopedic, like the way you do orthopedic, because you need it to heal perfectly. You need the cuts to be perfect, everything.
And the other thing about orthopedics is it's post-ops are up there for everyone to look at, and everyone gets to give. That screw is too long. That screw's in the joint. That plate's too long. That plate's too short. It's right there for everyone to look at. Whereas, you know, soft tissue, you know, it's just like, well, you know, he's anemic and his pressures are down, but that doesn't say, hey, everybody, you know, I did something wrong in surgery. So yeah, orthopedics, and it's interesting. Almost always residents will be way more comfortable with soft tissue way before orthopedics. And I think it's part of the reason is it's just way more stressful.
Would you ever cut a back?
Now?
Yeah.
I mean, I cut hundreds and hundreds of backs during my residency. We didn't have a neurologist.
Right.
We didn't have an MRI either. We did myelograms. Yeah.
So you had the post-eye seizures that you had to deal with?
Usually that was only the ones that were not non-diagnostic or didn't get surgery because we were recovering them right away. Whereas if you had them under anesthesia for a couple hours, the dye was gone and they didn't seizure. So it was always the non-surgical cases that seizure typically. And it was pretty rare, to be honest. But yeah, the 2 a.m. myelogram, those suck. Oh, they're horrible. But if they go well, they're very quick. It's just radiographs. But if you do an epidurogram or, you know, which I did many of them.
Right.
And I'm like, I don't know what this is. So
does every animal need an MRI?
For back?
I think MRI is a great tool, but I think it's overused still a little bit.
I mean, it depends on the disease, I think. So for disc disease and spinal compression, MRI is gold standard, no doubt.
Splenic mass rupture, hemoabdomen.
Definitely not. CT would be better, in my opinion. You don't need an MR. MRIs are so much longer. Yeah, it takes so much longer. They're way more expensive. CTs will give you the answer for that. And then in terms of I'll just say, orthopedic, like ACL, I just had a lady today say, thank you so much for not insisting on an MRI for her dog's ACL, which saved her $6,000 according to her.
Right.
I'm like, yeah, you don't need an MRI really ever to diagnose an ACL tear in dogs. Rarely in people too. You feel cranial drawer, you're done. So I'm not sure what the cynical part of me is, they're just trying to make as much money as they can. But medically speaking, it's not needed usually. But spinal imaging, brain imaging, MRI is the way to go for sure. For sure. Yeah.
Did you ever do anything with stem cells? Did you ever go that route?
Yeah, I did right after it came out. I took the course and got all that stuff.
I'm certified.
Yeah, I got certified. And so it was very exciting. And I remember they would charge us $2,000 to us just for the stem cells. And the problem is you have to harvest the fat, so it's a minor surgical procedure. You do a joint injection, all that stuff. So, I mean, it right off the bat would be very expensive. I don't even know what they're charging now.
No, I don't even
I don't want to know, yeah.
A lot of people using PRP.
PRP is the way to go. That's what I recommend typically because, there's not, as far as I know, there's not huge difference in results, PRP versus stem cell. I'm sure people argue with this, but for at least orthopedics, PRP is a blood draw and you spin it down and that's it. Versus stem cells is a minor surgery and thousands and thousands of dollars for arguably similar results. So for me, it doesn't make sense for the stem cells in general.
Did you ever have to have difficult conversations with people, with veterinarians, when it came to I'm never coming back to your clinic?
With veterinarians or clients?
Veterinarians.
Oh, me doing mobile surgery?
Yeah.
Honestly, I think there was only 2 that I had to have the conversation. They didn't get the hint. There's a few others where they would call and I'd be like, yeah, I don't have anything available for 6 months. So they would
what happened to me, asshole?
And yeah, you never got the hint. No. So most of them got the hint. A couple of them didn't. And one of them was, he never paid me. It was like 4 months later, and
yeah,
I'm like, dude, you gotta pay me eventually, or I'm not gonna just keep coming and doing.
Well, your wife is your bill collector.
She wasn't when I started. Yeah. I was doing everything.
Yeah, but then she became it.
She became.
I remember getting an email from her. Yeah, Justin's no longer collecting the bills. I am. I think that was good. That must have been a great conversation when she's like, "Oh, let me see your books or something at home." I was just going through my head, knowing what my wife would be saying.
She literally just tore me a new one a couple days ago because there was something, and I'm like, oh, I'll just do it. She'd be like, "Do not touch it. When I took this over, it was a disaster." And she went 20 minutes about how I screwed everything up, and I'm like,
there's
all right,
something to be said to have a very intelligent alpha dominant wife, like mine too.
Yeah.
Okay.
You
got it. Here you go.
Yeah, it's great. And I hate that stuff. I hate it. Like, I would be the guy, I don't know if you, all creatures, with Harriet and all that stuff. I always think of Siegfried, who's the guy that owned the practice that James Harriet worked for. And he would just get the money from his house calls or whatever, and he would get home, he would take a big wad of cash and shove it in a jar. And that was me. I would get paid, checks or whatever, and I would just throw them in a pile somewhere, and I would forget about him for like a month. And
wow.
I know you've made fun of me for this before. Yeah. And it's just, I don't know, I'm just not wired that way. Whereas she's on it.
Right. Yeah. Did she have business classes, or was she just more business in tuned?
She's just always been, very, she, thank God, takes care of the taxes and all that stuff. Where to me, like in 5 minutes, I get so bored. And I'm like, I know it's important, but I'm just like, oh my God, I can't listen to this. Where she like listens and takes notes, and she was one of those front row gunners that we had.
Yeah.
And I was one of the guys in the back. So she takes meticulous notes and very detail oriented about this sort of stuff. And I'm detail oriented, but with this stuff, I don't know what I can't stand it. It's like going to a mall or shopping. I don't know if you have the same feeling. My mind just shuts off. I get into this cloud. Like I go to a mall or I go shopping with my kids or wife or whatever. I feel like I'm in this mental haze, or I don't know. Do you get that at all?
No.
Okay. Well, maybe it's just me. But my brain turns off. I'm just like, I can't stand this. I got to go do something else.
Yeah. And, So what do you do to recover from a hard day? If you don't go, yeah.
Let's see. So What do I like to do? I just got an e-bike like a year ago, so I ride down kind of down the beach and stuff like that. It's fantastic. I like to, exercise, lift weights and stuff like that. Just started jujitsu, so that's kind of fun. Yeah,
Jiu-jitsu?
Jujitsu, yeah.
And you haven't pulled a hammy yet. That's
Not
pretty good.
yet.
Yeah.
No, I'm waiting for it. I'm sure. I know it gets harder and harder.
Hammy or Achilles, take your pick.
Yeah. Have you done it?
Jiu-jitsu?
Yeah.
I did it once and I was so sore I couldn't walk for like a week.
You get in such weird positions. You're like, your body's like, what
My
are
knees,
you doing?
my back, my shoulders, I just can't do it anymore.
Yeah. Yeah, I mean, I'm sure it's coming.
Yeah.
I mean, you step wrong these days, and you're like,
Well,
you're
you
out.
wake up every morning. It's like, what's going to hurt today? Right?
Yeah, yeah. You sleep wrong, and you're out. You're on the DL for 2 weeks.
If there's anything you wish to tell early career veterinarians or early career professionals that are just graduating, what are little hints you could give them
Well, I would strongly.
so they have this soft landing?
Yeah, absolutely. So I would say, don't chase the money. Don't take a job for the money. Usually the best offer financially is the best offer financially for a reason, and it's usually not a good one. So they're desperate, they're corporate and desperate, trying to just get somebody, and the number goes up and up and up because they get more and more desperate, and they're desperate for a reason, whatever. It's not good. So those for a first job would be very challenging. So right out of school, I'd strongly recommend, if you have anybody actually, I'd strongly recommend a good internship if you can do it.
Right.
You take a hit financially, I get it. It's another year, I get it. You're constrained with travel, so if you have kids and a family, I get it. But if you can do it, I strongly recommend it, a good one, because that mentorship and training will go with you the rest of your career, and it will give you a lot more fulfillment with your profession, in my opinion. Just getting that little extra training, because you don't get a lot of real good clinical training at most schools, it seems like these days. And that's going to be real practical training for you. And if you can't do that, try to find somewhere that's really going to be focused on mentorship like we talked about. Find some guys like you, a practice that has someone like you that enjoys mentoring, cares about you, wants you to succeed, rather than you're just another walking vet
Right.
license.
And you only need one doctor. You don't need 9.
Yeah.
You just need one doctor.
One good one, absolutely.
Right. You don't need to go to a practice that has 9 or 10 veterinarians, because there's probably 9 or 10 veterinarians that do not care to mentor you.
Absolutely.
You need that one. You need to find that one. And then hopefully we'll get them going on the right track, right?
Absolutely, yeah. And for specialists, never take a job as the only specialist in your field right out of residency. It never goes well. Rarely goes well, I should say. And do not do mobile right out of your residency. Do not. It will not go well. Trust me. So same thing. Go somewhere with good mentorship, a couple years at least, where you can pass boards, specialty boards, and then get that mentorship that will serve you the rest of your career.
Do you think you weren't ready for mobile after cutting thousands and thousands of cases during your residency?
Right out of my residency, I could have done mobile, but no, it would have been a disaster. And it's not just about being able to cut TPLOs. Yeah, I could have cut TPLOs, but that's not all you're cutting. But it's also about having the maturity, the experience, how to deal with things that don't go well. Your belly's exposed as a mobile specialist. You're at your guys' mercy completely. So if something goes wrong, the conduit is through the GP. And so if that GP decides to throw you under the bus, you're cooked. Whereas, and you're going to be able to handle it a lot better if you have some experience under your belt.
And you need to be comfortable with the GP, because heaven forbid an emergent situation happens while the case is under anesthesia, right?
Absolutely.
You got to make sure that they have the resources to help protect you.
Absolutely.
But you had your RVTs with you, and you had.
I learned very early on I needed to bring at least one.
Your people.
One, not just for anesthesia, but like, hey, grab me the Flugel binder. And most people.
God bless you.
Yeah, exactly. They'd be like, "What is that? What are you talking about?" And then it's 20 minutes looking through my stuff trying to find it. Whereas my techs know exactly what I need for everything, so it just makes it so much smoother and better. Yeah.
Unbelievable. So for those listening, if they have any questions for you, what's the best way is email the best way to get a hold of you?
Oh, yeah, thanks. So I am in a practice. I am doing a little bit of mobile surgery, but I am at a fixed practice as well in Mission Viejo. It's in the Bright Care vet group. The practice number is 949-777-5594. And the email is hello@precisionvetsurgery.com. And then my email is drgrecco@precisionvetsurgery.com. No one can spell precision, I've learned. So that was actually a horrible practice name, and I would have done something easier to
I thought hello was pretty good, though.
Yeah. Most people can spell hello, but not precision. And actually, sometimes I'm like, wait, where do the eyes go?
Yeah, exactly.
Yeah.
But no, thank you so much. I'm going to have
Pleasure.
you on again with your buddy.
Yeah,
we're
that'd be fun.
we're gonna get two surgeons on.
And he was a rotating intern at AMC when I was a third-year surgery resident, and had a blast. And then he went to Penn as a Penn Fellow, and I was a lecturer. We had so much fun. Yeah, he's such a good guy.
Absolutely.
He reminds me a lot of you, actually. Yeah.
A lot of me?
Yeah.
Oh my God.
Yeah. Not just because you're
that'll
both.
be interesting. That'll be very interesting.
It'll be fun.
Yeah, no kidding. Yeah. Well, thank you for listening. Hey, if you guys have any questions or have any listeners you want me to try to get on the show, please let us know. Please subscribe. Please follow us. Remember, we're here for you. We want you to enjoy this profession as much as we have. It's been very, I love this profession. I love everything about it. And I just want to make sure I can help all of you have the same warm fuzzies that I do about the profession. We'll talk to you all next time.